Hi everyone, this is Mr. Neil Writer, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended, I think it was yesterday actually, and I'll give you the backstory. So they're a very elderly patient, and when they were sat on the chair, in part because of their age, their head was tilted really forward. So it was hence the angle. You can see that I'm always performing this. So the top of the ear canal is at 9 o'clock. So we are almost rotated 90 degrees anti-clockwise. And I wasn't able to sit on my medical stool. I actually had to almost kneel down on the floor and look into the patient's ear. And it's just because they weren't able to put their head up. So, and quite often in clinic we have to deal with these things. That's part of the job really. We have to adapt and be flexible. So now the patient, the reason for they're attending is that they got bilateral, so in both ears, they got NHS, so in the UK, the NHS, the National Health Service. So taxpayers fund the National Health, and as part of the NHS provision and service, patients can get free hearing aids via the NHS. But unfortunately, they had lost their hearing aids, and they went to the audiology department to get some replacements, and their hearing aids had ear molds, so earpieces attached to them, and the ear molds were also lost with the hearing aids. So the patient attended the audiology department to have their impressions taken of the ear, so new ear molds can be made. Unfortunately, they had all this occluding dead skin actually, so it's not wax, it's dead skin. And therefore, the audiologist quite rightly said we can't take the impressions because of the wax. Now, in the UK, a lot of NHS audiologists, although they may be trained to remove wax and they might do a bit of private work, they typically in the NHS, it's not a routine service offered by audiologists. I know myself because I used to work as an NHS audiologist many years ago. So the patient went to a big high street name to have their ears cleaned, but they weren't able to remove this, or actually the right ear was the worst one of the two, and the patient's son did some research, heard about me, and booked him. They're very sceptical that I'll be able to remove, although despite reading all about me and watching all the videos, it's just that when they were booking, they advised that the person that they saw previously struggled so much that they were not having doubts of my ability, but when someone's struggling that much, they felt that they were a bit worried that because at the time of booking we do take a default appointment fee just to warn people off from not attending the appointment, and they were worried that if I weren't able to remove the wax, would they lose the money? And I just give the money back if I can't do it. It's very seldom I'm unable to remove wax. In fact, ironically, today is one of those occasions. It's been a long day, and I had a child come from Manchester, age 12, bless him, actually came last week as well, and they had a build-up of wax for 5 years. Went to the doctors at the time, just so there was age 7 back then, just advised to use olive oil, and obviously it's progressed a lot worse, and the patient attended last week. They went back to the doctors 2 weeks ago, and they referred to ENT, but the waiting list is so long, so the patient's father did a bit of research and brought the child to see myself, and the patient had the most severe case of keratosis obturans. I managed to so when they came last week, the child, I asked them to rate their hearing in terms of on a scale of 10, so 0 being not being able to hear at all and 10 being able to hear perfectly. And they rated themselves as 2 out of 10. And I was there for about an hour with the child, and I managed to remove 2/3 of the blockage. And there was still quite a lot of keratosis obturans left. It was the most severe case. I was showing it to the father and the son, watching it back, and it was a case of, I explained it's like dried, sticky chewing gum, really filling up the lower part of the ear canal. I'll just come back to that in a moment. So you can see I just peeled all this skin away. I just used some forceps there. Now the patient has got a bit of a bumpy ear canal. It goes up and down. There's a few slight erosions here. So this dead skin over the years, it's possibly become a bit infected, and it's just eroded some of the bony part of the ear canal, but there's no active infection there. There's no hint of canal cholesteatoma, which we need to be investigated further. Now, this is the left ear. If you stay tuned to the right ear, you'll see that the patient has got a bit of an infection on that side. It's a bit more complex to remove there. So yeah, I managed to remove 2/3 from the child's ear, and so I said, come back in a week. You need to use sodium bicarbonate drops. I mean, 3 times a day I recommend it for 10 minutes at a time. So it really soaks. And the return today, and almost immediately as I went in the ear, the consistency of this keratosis obturans just didn't change. It was exactly the same. And immediately I explained to the patient and the father, they travelled a long way as well, that it's going to be very likely that this needs to be removed, because it's obviously very painful as well for the patient. One of the landmarks of keratosis obturans is Altalgia's pain. That's one of the hallmarks that separates keratosis obturans from a normal wax buildup, for example. Not to say that normal wax buildup can't be painful, but most cases of keratosis obturans, people suffer from one of the biggest symptoms is pain. And again, I tried for an hour, managed to get a bit out, and I rang my colleague as an ENT surgeon, Mr. Darius Rajali, and explained the situation. And the best advice, and he said, well, in some cases this happens, but we're not allowed as audiologists to administer any local anaesthetic, because if it was, it probably would have been able to remove. But having said that, it was still complex, so Mr. Rajali advised that even sometimes with local anaesthetic, sometimes you just have to do it under general anaesthetic. And because it's been there for at least 5 years, it's really become part of the ear, that keratosis obturans. And so we've referred back to the GP and just requested an ENT referral, which they have already, but just to explain the circumstances and whether it's just possible, as opposed to just having initial consultation, just getting them booked in, or making the ENT aware that this is the case, and possibly have a longer appointment just in case. They may wish to see an ENT privately, because the waiting list in the UK is quite astronomical at the moment. It's about a year, possibly even longer. My personal gut feeling is that it's going to have to be removed with general anaesthetic, but I've advised to continue using the drops, the sodium bicarb drops, which is the best thing to use for keratosis obturans, and hopefully see ENT. Now, ironically, they're having a surgery done on their throat as well, this child. Father wasn't sure, but most likely due to by an ENT, so they're going to be on general anaesthetic also. So in this letter to the doctor, I explained that would it be possible for them to get in contact with whoever's going to be performing the surgery, and if it's ENT, whilst the child's under general anaesthetic, could they just do the ears, because it'll kill 2 birds with 1 stone. So the reason for telling that story is I actually refunded that patient. I wasn't going to charge, although it significantly had improved their hearing. It was from 2 out of 10 to 6, 7 out of 10. I just felt, just give it back, and just in case they decide to go private to see an ENT who can administer local anaesthetic, I'll rather them spend that money towards that. So the patient was very grateful. So just come back to this procedure. So you can just see, I'm just trying to, the canal is very narrow here. They've been scratching their ear. You can see it's quite sore. Behind this plug of dead keratin, there's a big furuncle. So a furuncle is an umbrella term really for swelling, or soft swelling. It could be full of pus or blood, a bit of discharge. Now, it could just be granulation tissue as well, but the patient is elderly, and sometimes you've got to be careful with a condition called necrotizing or malignant otitis externa, and it can be quite dangerous. It typically occurs in the elderly or patients who are diabetic or immunocompromised, and it's when they have an ear infection in the outer ear, but the infection can't clear itself. You can see here. Now, it's originating from the base and from the front part of the ear canal. I've got a feeling it's just... I'm not overly concerned, but we can never be sure. We can never, take guesses in this job. So I have referred to the GP for some medication, and just indicated that it possibly could be this necrotizing otitis externa, which would require more heavy duty medication. So the patient, I've explained to them and their son that they can't go for the impressions yet, because it will be a wasted journey because of the swelling. You wouldn't be able to take an oral impression of the ear with that swelling there. So I've written to the doctor, they're going to get some medication, and I've always advised them to go back to the doctors after the course of medication just to make sure it's cleared before going back to ENT. Now, the patient's got, not ENT, audiology for the impressions. The patient's got very poor mobility, so we don't want him to make a wasted journey to the hospital to get the impressions taken unnecessarily. Well, I hope you enjoyed that video, guys. Take care, keep well. Remember, be nice, be kind. Bye.